What is glaucoma? Glaucoma is a disease that affects something called the optic nerve. And your optic nerve is this big cable that connects the eye to the brain, and it's part of what helps us to see. So glaucoma causes the healthy tissue around that big cable to thin out, kind of like eating the middle of a donut. And it doesn't have any symptoms. So people don't know that they have glaucoma unless they come in for an exam most of the time. And it will affect the peripheral vision first, and then slowly, if it's not being treated, it starts to affect the center of the vision. So really what glaucoma is, it's when the pressure inside the eye is too high for an individual. And over time, it starts to cause damage to the optic nerve. What are the early signs of glaucoma? There are actually no symptoms or signs of glaucoma unless it's progressed. Because glaucoma affects the far periphery first, people don't know they have it unless they've come in for an eye exam until it's usually much more advanced, and then it's starting to affect the center of the vision. But most of the time, there really aren't any signs and symptoms. So how do you know if you have glaucoma? You have to come to your eye exams. Often people will get sent in because they're told that they have high eye pressure, which is sometimes one of the first things that we'll see on an eye exam. A family history gives you a stronger likelihood of possibly developing glaucoma in your lifetime. But again, there are really no signs and symptoms, so you have to make sure you're getting an eye exam. So can glaucoma be cured? Glaucoma cannot be cured. We can treat it. Once you have glaucoma, you have that diagnosis forever. But we have the ability to prevent it from progressing. So people really do not have to lose their vision from glaucoma anymore. So how do we treat glaucoma? Often the first thing we'll do is we'll start you on an eye drop that you use once a day. And we have like 6 or 7 different kinds of eye drops, probably even more, that we can start you on. Some people, the thought of using an eye drop every single day, potentially for the rest of your life, is just suboptimal. So we have lasers that we can do where potentially you don't have to use eye drops. There's this amazing shift in glaucoma treatment now where we can actually place medicine directly into your eye, and it stays in there on average for 6 to 12 months, slowly releases the medicine, and then you may not even have to use eye drops. And then there's always surgery if we need to use it. Yes, glaucoma can lead to blindness if it's not treated appropriately. And that's why it's so important to get an eye examination every single year to make sure that you're being screened appropriately. So how would you know if you were at risk for glaucoma? One of the best things you can do is go see an eye doctor. They'll be able to check your eye pressure, see if there's any irregularities in terms of having a higher than expected eye pressure by looking at your optic nerve, which is in the back of the eye, seeing if it looks suspicious for glaucoma. And then of course, if there's a history in your family of glaucoma, you're at a higher risk. So all those things are ways that you can kind of screen it early and prevent blindness. So it can reach a point where all of a sudden it causes a person to lose vision, especially different kinds of glaucoma. So nowadays, we want to prevent you from losing any vision at all, and we can definitely help to do that by treating it early.